Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Erin Carn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along.
Hi there, kia ora. I'm Erin Carn-Bennett and coming to you live today from Hotel Panfili, Roma, here in Italy, and I'm here at IPSSW 2026 on May 6th today, which is really exciting. The second day, everyone's getting into the swing of things, starting to network, and it's really exciting. I have got with me here today Eduardo Frias from Montreal Children's Hospital. Now, I did not go to Eduardo's talk or presentation. Actually, I don't even know if it was a poster or anything, what it was, Eduardo, but it was highly impactful, and I'm really keen to and curious to learn more all about this project. I got asked to come and record this with you. So, yeah, I'm really, really excited to hear about it. So, Eduardo, would you like to, I don't even know your background, and so I'm really keen to have a chat with you and to learn about what's your professional background. Maybe we'll start with that and we'll go from there. So over to you, Eduardo.
Of course, thank you very much for having me today, Erin. It's such a pleasure to be part of this podcast. And yeah, it came as a surprise also to me. I was not expecting this, but it was great to see the interest around the project, and now to be able to share it with you, it means a lot. So, like telling you a little bit about myself, I'm a Mexican Canadian, like medical professional. My area of expertise is, of course, pediatrics. I did my residency in pediatrics back in Mexico. Then I repeat my residency training in Canada. And now I'm doing a pediatric gastroenterology and hepatology fellow at Montreal Children's Hospital, which is home, with McGill University. I'm really passionate about pediatric gastroenterology, but my other phase is that I'm super passionate about medical education, and I have been involved in pediatric simulation and medical simulation in general, maybe for the last 7 years. So I have had the opportunity to work with a couple of programs in Latin America, also in Canada, and it has been an incredible experience. I have learned a lot. I keep on learning more, and I'm getting more and more passionate as I get to learn. And our events like this ones who keep us like ongoing and recharge batteries to like keep on working on the field. So I'm super fortunate to be here with you today.
You're most welcome, and thanks so much for coming, Eduardo, and answering the call to come, as well as myself. Obviously, we're here, and it's great to hear. This is really interesting, your background. And can you tell me a little bit more about your IPSS story? Like, is this your first IPSSW? How did you come to be involved in IPSS?
Yeah, this is my first IPSS episode. Hopefully not the last one. I'm sure that it will not be, because so far like the full experience has been great. While working in this project, one of my mentor, Dr. Ilana Bank, she strongly suggests coming here to share, discuss, because even when we had participated like in different like general simulation communities, like to have a really like pediatric focus one, I think that it is something like super important to learn and also to be seen. And yeah, so that was how I got here. And of course, it's not going to be the last time. It has been amazing.
Yeah, thanks, Eduardo. And I think you've really touched on like a couple of really key points here. I love that you've been involved in simulation for 7 years, and this is your first IPSSW, and here we are doing a podcast. So this is so good. And, you know, obviously with your background, you know, you've come from Mexico, and now you're in Canada, you know, you've come from kind of like low middle income country into like a more highly resourced country. And we need all of your linkages into these countries. We've just been talking about how we can get IPSS more into these areas. So you are exactly the kind of person that we want to have at this conference. And this is really, really exciting to have you here today. And I think the biggest thing for IPSS is that we aren't a big society, but we're highly impactful on the people and people's progression in pediatric simulation within their academic world, within their clinical world, within the education world. And I've been in talks this morning all about, people saying who are really big notice here in our international community, talking about they would not be who they are without IPSS. And that is really the message that we're trying to get out to people. IPSS, I think about my own personal story. And, I only went to my first IPSS in 2019. I joined simulation in 2019. So I actually joined simulation after you, Eduardo. And my first IPSS was in 2023 in Lisbon. And this is my third IPSS, and I'm on my second term of the board and, helped set up this podcast and things. Published my first paper in December, which, I had a lot of mentorship and support and guidance from the IPSS community. And I think that's a really key thing here is that, like, for most of us, we want to give back, especially to our low and middle income countries. A lot of us come from quite highly resource settings. And like, how do we connect everyone and get into these spaces? And I mean, that's probably going to be a whole episode on its own. And like you say, probably not your last episode with us, which is exciting. But, so tell me, before we get into your project that you've been presenting here, Eduardo, can you tell me a bit about your simulation story? Like, how did you get into simulation and what impact has simulation had on your career?
So, serendipity. I think that simulation found me because I was not looking like anything with simulation.
Yeah.
And I will say also like a little bit of luck. Like just before COVID, like I was like we were like discussing my wife and I about like looking at opportunities, moving like other places. So I was doing pediatric surgery actually at that moment. And as you were mentioned, like the contact that we have with simulation is not the same when you are trained like in the different like income countries. During my training, there was not a lot of simulation involved, and I got into pediatrics resident in Mexico, and I started like having some contact. I have an amazing program, but still there was like limitations for like doing like simulation. And when I was doing that first year of pediatric surgery, that then I quit because of my or like life like objectives change. That was when I really like started like seeing a little bit about it. But I have the chance to have like two amazing friends, Dr. Adrian Gonzalez and Dr. Dr. Adrian Morales, sorry, and Dr. Ramon Esperon, who invited me in this transition when I was looking for like new opportunities to develop myself to develop a simulation program in Mexico. At that time, I was like really naive about medical education, about medical simulation. And we started like building from scratch that simulation program at the beginning in the West Coast University simulation lab. And it was like a full transition of learning, improving. And then a big challenge came into our lives, which was COVID. Okay. We got the big task in ourselves to build like a program that will be able to sustain education for those trainees, those interns who normally will go to have like, their clerkship and their first exposure to the medical hospitals, but from home. So can we develop a strategy or a tool in order to keep on those students or like and these like trainees having like simulated contact with patients? And at that moment when we were using like standardized patients in order to have discussions, in order to do like medical interviews and all of this like from a remote setting in order to like keep on with COVID like like policies at that moment. And that was an amazing opportunity to start building on simulation and start learning more about like educational strategies, approaches. And then we moved into Canada. And I was looking for a job, and I was making a transition equivalence. and all like the medical like process in order to get back into practice, like getting into a new country. And I applied for a job in Montreal's university like healthcare hospital, which is called the CHUM, the Centre Universitaire Santé of the University of Montreal. And at the beginning, I was like applying even like from a SimTech position.
Right.
But when they read a little bit about what we were doing in Mexico, they invited me
Right.
to have another like perspective. They invited me to have a role as a simulation program developer, and that gave me like a full new perspective into simulation. I was able to keep on developing like the educational strategies, but that bring me like into another like world, which was like evaluation, and how can we actually measure the impact of the things that we do in practice. So it was putting like together this part of like the needs and the analysis of needs, and like the needs assessment, and also like the impact measurement of what we're doing. So, like doing reports, then uh, giving those impacts feedback to the different departments, that was like something that I really loved. Then they sent me to Sweden. We got involved into like disaster simulation, like with the Emergo Train System Academy in Linköping, and that opened the doors for the first like North American Academy, which is now at SHUM for like disaster simulation, which was part of that first cohort of trainers. And then when I got back into like my clinical practice, Dr. Ilana Bank, my mentor, she invited me to participate in the Pediatric Simulation Institute at McGill University, where I am now. So it has been like a full like process of growing. I have the chance to get to know like amazing people through the process. Adrian Morales, Ramon Esperon, Audrey Morel, now Ilana Bank, Julian Varas. I really like appreciate, and I have to mention them because they were part of building that simulation person that I am today. It has been a full part where it has been super fun getting here.
Wow. So when you first came to Canada, you weren't applying for clinical jobs. You were applying for simulation technician job. Is that what? Yeah.
Yeah, it's right. Because
Wow.
I mean, to get back into a clinical practice is a full pathway that
Yes,
takes
of
a couple of
course.
years.
Yeah.
And at that moment, I mean, I'm a person who does not know how to do a lot of things. I know about medicine and I know about medical education. So I was lucky to be able to continue working in that I love, and also super lucky also to get the integration of both worlds now that I'm back in my clinical practice, in order to keep on like developing this and being now kind of an advocate for those who are like pursuing this kind of like pathway. So
yeah, I think like you're really touching on some key stuff that can relate to probably a lot of people. Like I started out clinically in children's emergency, and then I went into nursing management, and then I segued back into medical education and into simulation, and then I immersed myself in simulation without the clinical, and now I'm doing a blend, and it's a good balance for me, and I think the balance is hard to get right, especially when you're younger and you have young family and things. It's very challenging. But I think simulation has a lot of knock-on effects as well, like personal development and yourself as a person. Huge amount of things that it helps to help you as a person to grow and to be a better human at home for your little people, or your partner, or just yourself as well, your community. Do you still are you so? And I find it really interesting how you were learning simulation, but were you also building a simulation program at the same time in Mexico? Or was that kind of like, did you have people that were doing, like, how did that work? Tell me a bit more about that.
like back in Mexico,
Yeah, when you first started doing simulation.
yeah, so there was an amazing team there. I was included into this team that had like big like representatives like in the Latin American like
Right.
education
Okay.
environment. So I was like brought to the resources, to the right people to talk, to learn. I was under the mentorship of these like physicians that I'm mentioning, and they guide me. They give me like the full like coaching of it. It was kind of a like ongoing fellowship when I was there, because I had like this like coaching, continuous coaching through
So
this process.
important.
And then
Yeah.
I was like just left into the woods and like,
Yeah.
but with the appropriate tools, I guess, in order to keep on like developing and building on that.
Yeah. And I think like you'll really find, most of us find in the IPSS community, like this real home for us, like in our simulation role. It's just so lovely to be able to come somewhere like IPSSW and to be able to speak the same language and be with people who have the same passions as you or the same problems or the same. There's just, healthcare organizations are set up so differently internationally, but as a pediatric international community, we all share the same struggles a lot of the time. So it's really, but we're very small, so they're very impactful and very important. So thank you for sharing. And we're really growing our Latin America kind of like contingency in all the countries and the cultures and things, and looking to overcome things like barriers such as language and things. So yeah, I think it's really great that you're here with your background, Eduardo. And I would really encourage people to come into IPSS as early as possible in their simulation career. Like I was so fortunate that one of the first things I did when I joined the sim team was I came and I joined IPSS. So that was literally on the first day. That was one of the first things I did. I had was incredibly fortunate to have guidance from Trish Wood, Mike Shepherd, many others, and they first job was join IPSS on day one. That was a great decision. So yeah. However, I'm really interested to hear now. Just going to, divert. Can you tell us a bit about what was this presentation that I'm hearing all about? Tell me a bit more about what you've presented with us.
So I want to put you like in the scenario so you can like really like live through like the first like person perspective, like the situation.
Okay.
So let's imagine that you are a pediatrics resident, okay, or like it could be also like a resident in any other medical profession, or even a nurse, an RT, or whoever it is in the medical professional. And you're expected to be competent in a specific technique. Let's use, for example, the lumbar puncture. Okay, and in the last couple of months, you haven't had the opportunity to perform not like any. Okay, because it is like difficult to have that opportunity. It's not always like the case that we have a patient needing a lumbar puncture in the ER. Okay, and the last time that you actually perform one, the ER was like so busy at that moment that your supervisor couldn't give you like meaningful feedback. So at the end of the day, you just like left wondering, are you actually competent or you are just like hoping you are? Now like the full like medical education framework is changing like into a competency based medical education system, and the trustable professional activities, the APAs, are the core of that. And the main idea behind this is that if the trainee can be trusted to do a task, then they are competent. But in real life, we face like different like struggles and limitations, as for example, limited faculty availability, unpredictable clinical exposure, and time constraints. And even if the opportunities happen, they don't always come with the feedback we need to improve. So simulation was meant to solve this. Okay, but simulation its own still have like different like challenges. For example, not all like the physicians or nurses like in the field have experience with simulation, or like will know how to conduct one or how to give a debriefing after that. Scheduling, for example, is always a problem. We gotta get like a multidisciplinary meeting like in the same room and stop like everyone's activities to have like a same agenda. And resource limitations that we were discussing, it's always like a struggle. So it's all of that, and the fact that simulation, like as the traditional simulation as we know, sometimes it feels scheduled, infrequent, and not always allowed with what we need. So then we ask ourselves, what if we change the way that we see simulation? And instead of being a scheduled event, to make it more like an habit. If we can transition from the simulation area or thinking of going to a simulation set to the idea of going to the gym. So this is the sim gym. Okay.
Nice.
So the idea behind the sim gym is that you go to the gym when you want to go to the gym, and you go there to train what you want to train. I don't know if you want to like develop the biceps today, you want to do leg day, whatever you want to train, you are there to train that what you need. If you need cardio, you're going to go to do cardio, and you will have someone there who's going to be able to coach you to get those goals that you are looking for. So that's like the main idea. We're developing this like space, a dedicated space for simulation, where the gymnasium like instruments are going to be available for you. In this case, the mannequins. Okay, you get into the sim gym, you got your like credential because there's one. You get there and you get to work in what you need. Okay, so I will guide you a little bit through like what a process of a sim gym looks like. Okay, so we're implementing this program right now in our pediatric simulation, and sorry, in our pediatric residency program. And the residents will schedule a visit to the sim gym. The sim gym is there. They get into the gym and they ask, for example, I need to like practice my lumbar puncture. Let's go back to our first example. They will practice in the mannequin as many times as they think that it is needed in order to feel themselves like competent. And before that, of course, they already assessed videos in our like digital platform. They got like the instruction and like the theoretical training before behind the procedure, and then they go to the gym. And at the gym, they will perform as many times as they needed in order to be comfortable with the procedure. And then they will be evaluated. And that takes us to the second part of our sim gym. The other difficult part about doing a simulation, as we were mentioning, is having those experts present for the moment of simulation. Okay, like having like the ICU head nurse in order to conduct the simulation there that day. It's a struggle. So we will maybe like program this for 2 months. So why if we do that evaluation in a synchronous way? So you're at the gym, you are now like feeling yourself competent in order to make the procedure, and then you will record yourself by doing it.
Yeah.
A camera is gonna take it, and then that video it's gonna be uploaded into a safe platform, or it's in a cloud, in a platform that we use, which is C1 Do One. I will tell you more about the platform that we use after. And then that video will send an alert to the physician's cell phone, the physician's computer, that there's a video like ready to be assessed. That person, it is an expert in the procedure that you are doing. In this case, that could be a neonatologist or that could be an ER physician who are like really like an expert behind like doing lumbar punctures. And at their phones, there will be or at the computers, they will be able to actually give you like objective feedback in what you're doing, meaning that you can draw around the procedure to mark like the correction, I don't know, of the position of the needle while going through the skin. Or you can like mark that maybe it was not at the like vertebral level that you were addressing, but it was like lower with an arrow. You can give a like a verbal feedback in the specific second where that's happening, and you can also like give a note. So that allows us to send back to the resident, to the student, to the nursing training, um, objective assessment of what they are doing with real like signals and like marks to those things that could be improved, which we think that it is much better than just saying you did well after a surgery, after a simulation.
Fantastic, yeah.
And then that will like complete the circle where you are able to go to the gym, get trained, get evaluated, and then to have like that complete assessment from the other side. And the other incredible part of this is that we are trying to make a fully comprehensive program that helps everyone in different ways, meaning that the participant will be able to have that practice, that training at the gymnasium, as we were mentioning, and then have a high quality evaluation and feedback, while the physician will have the opportunity to actually ask for different kinds of credits on the time that they are doing on teaching or in simulation, because we are tracing all the time that they spend giving those reviews. We have like an actual archive of all the feedback that they do, the kind of feedback that they provide, and like, it will depend on the kind of like state, province, or country where you are working and the different like associations that work with you. But all of that time which is invested and it is recorded, can be accredited as credits for like continuous education development, or even can be paid. Okay, so this is a circle where everyone will be like encouraged to keep on going, and it's going to the gym. You start like looking, you just start like realizing the changes that happen in your body, how you're developing more like muscular mass, you're feeling better in the mornings, you're running better. We hope that our trainees are getting like this feeling of feeling like more comfortable when doing procedures, more comfortable when addressing a clinical problem, and also we're giving the opportunity to like the evaluators to keep on developing their educational approach, their debriefing capacities, and also keep on going with a full educational curriculum that can be tracked and documented. So that's a little bit what it is behind of what we are doing in the Sim Gym. It is an ongoing project right now, but we have been able to launch a couple of surveys in order to see what's the feeling from more like residents, and 100% of residents have like a positive experience so far. 78% rated the task as easy, 96 reported a low stress environment, and 100% of them agreed that the simulation was comparable or superior to traditional simulation methods, and indicated that they were willing to go back. And we are seeing that there's not just new members of the gym, they are going back, and we are looking for new strategies to keep them like in the project. We are now starting to think up the next steps that we're going to develop like this membership program, where you'll be able to be like silver like a trainee, like a golden trainee, a platinum trainee, depending on the number of times that you go. And we will try to give like perks, as for example, you get to choose for next month which ones are the benefits that are going to be available for you at the gym. And we are expecting that this like kind of different rewards all around the program will keep on the program going, and we'll keep on like this new approach to be like something attractive to different programs, because we think that there's like potential behind this. We are like really trying to change the approach that we have to simulation, because we think that it's difficult to build competency through chance exposure. So we are like proposing really to build it through access, repetition, and intentional practice. Because what we're trying here is to give the residents the control over their own learning, so they can say, I need to build this ability, and I know where exactly I have to go in order to build it. So that's kind of like the framework. We're trying to make like this like change of practice, creating like an habit, a philosophy behind what training should be look like. And we're using this analogy with a gymnasium because we think that it's like really comparable, and with that, if we put that like enthusiasm in the trainee, that will be something like more like suitable to be done.
Well, so Eduardo, I've got so many things I wanted to comment about this. Apologies, team. We've got vacuuming going on in the background here, but we're going live from conference, so unfortunately, you might just have to live with the semi-low quality sound here. What skills are you using in the sim gym right now?
Sorry.
What skills are you doing in the sim gym now?
That's a
LP?
super, yeah. So that's a super like good question, because we wanted to start with things that were like easily measurable. Okay, meaning we start with really like technical skills. Okay, that we can have like easily traceable performance indicators in order to have like results of what we're doing. But of course, our ambition goes further. Next step for this will be to start like putting soft skills on that. Like for example, can we do the sim gym for having a difficult conversation? Can I go to the gymnasium to actually develop my capacity to like give bad news to a family? Those are like the next challenging. Even further, we want.
I've got so many things that are spinning around in my head, Eduardo.
There's a full pathway that we want to follow, and it's like, can we, now that we were like discussing about the trainers, can we do a gymnasium for their debriefing techniques? They are debriefing
that's
here.
what I'm literally thinking. Yeah.
And we want to go with the gym, to the gym with them, and give them the opportunity to debrief, and then set this debriefing to a master debriefer that can actually like point the improvement areas that can be like done better and give a actionable objective feedback on the feedback. So meta debriefing, I think that will be like the last step for this process.
Have you heard of Nathan Oliver's work from Australia? There's also a group in Scotland that he was linked in with. Christian Kind, who I actually got to meet in person. He's moved to New Zealand, but he's another big name behind Meta Debrief Club. And I saw one done live at the Laerdal Sun Conference in June 2024, and that was fantastic. It was literally just an iPhone on a tripod and the phone only looking at the debriefer. And I think it's really successful. And I think that this whole concept, I think, is very successful. When you go back to adult learning theory, like probably one of the hardest lessons I've learned in my simulation career is, like I sort of talked in my Inspire panel conversation pre-conference about Todd Chang rattling around in my head from Lisbon 2023, always start with the learning theory. And some of the work I didn't start with the adult learning theory. But when you go back to adult learning theory with this, you've got really motivated learners who want to go to the gym for something, which is fantastic. And so I think this is why it will be really successful, Eduardo. It sounds like it already is. You've got a motivated learner group, and you've got people who want feedback. So I think those are two key things, right? There's nothing worse than, I think you get to a certain stage in your simulation career where I analyze my own debriefs and yes, I do want feedback. But there are days where I'm not in the right headspace. I know I haven't performed. I'm already highly critical of myself. And so then if somebody comes and gives me feedback, which I haven't asked for, I'm not ready to receive, and I'm not that I'm not motivated, but I don't want to receive it right then and there, or in whatever means they're presenting it to me. That's where your psychological safety is compromised. Whereas you have a motivated learner who's actively seeking feedback, and you're linking in key measurables with experts. And, I think of when central line port accessing came into the Children's Emergency Department more than 10 years ago, I was a charge nurse at that time. And so we had to really roll out pushing through the nursing staff to get this upskilled in this skill. And so I actually missed out a lot on becoming an expert at this skill. I could do it, and I was often called in to do it, and had the confidence to do the skill because I was senior and just knew to push through. But it was like, was I, in terms of haptics, procedural skill, I never quite got that, that sensation haptic down pat, right? Then I've been in education, and now I've come back into clinical. So I was never an expert, and then I've had a big break around it. And, that's something that I think I would go to the sim gym for. And it's on my to-do list. I know I have the emails. I'm supposed to be going up to the oncology clinic to do a whole lot of these poor accesses so I can get my haptics sorted. And because, we do get these children come through Children's ED, and I know I can do it, and I have been doing it. I've been going to the sim gym informally when I can, but I still need to get that. I've got the motivation, but I just need to book it in and do it, right? That's another example of, I think, probably a really good one that would be fantastic for anyone that has to access ports. And then also, I love that you're thinking about adding soft skills on there, how you communicate with people and things. The meta debriefing stuff we've already started to talk about. One of my passion points is resuscitation, teamwork, dynamics in the Children's Emergency Department. And I bang on about it all the time, but, I co-founded a course called Sim to Lead, which teaches nursing and doctor co-leadership in resuscitation. And I'm really down this rabbit hole now of like really intentionally thinking about and teaching people all the time, how do you craft your resus team to achieve what is required for the patient? And that comes down and being really specific in a role definition, because you can say you're the CPR coach, and I think this has been talked about. I've seen some fantastic talks and a lot of questions by a lot of people being asked about CPR coach. That's a really good example. I did that clinically in a case in January, and I had been teaching it a different way that had much more roles assigned to that role, wasn't as clearly defined, but having that clinical experience of doing the CPR coaching and running the defibrillator in a code for a shockable arrest made me have the realization that you cannot do that role. For me, it was all I could do was the timing, the CPR quality, and the defib, pressing of buttons. Nothing else.
And this is an amazing point that you're touching there, because I think that that's an amazing example of how this like new SimGym approach can be used. You have
teamwork. You could analyze your teams, your compositions,
and you have like, for example, CPR like trainers, as you're mentioning. That's a skill that needs a lot of repetition in order to be, and a lot of like refreshments.
Yes.
You know, you quickly get forgotten about like how to do it. Now like your like rhythms, or you need to improve like there's like new guidelines coming in and out. So you need like this going back into practice. And as we were seeing in a couple of like different discussions around the day, like that revisit of how are we going to maintain competence in these groups? Should we do like another like big like program, or should we ask a full day out of their times in order to get them? What if we can have a gymnasium open where they will be able to go once a month, once like 2 weeks to train, I don't know, my compressions, or I need to train my POCUS abilities. And then I don't need the trainer to be there, because I just can like put it there, and the trainer will come back to me with a like comprehensive, like objective feedback. And I can keep on with this like refreshment and competence maintenance through the year, and everything is recorded. Everything it is like documented, and I'm able to like keep on the front of the like having my title of a resuscitator coach, for example, and like certifying myself. And I actually like I'm able to like work, because one of the things that I think that works like as an excellent motivator for like learners is like this belonging, like feeling like I belong to this group. So I'm a resuscitator coach. I got my pin, or I got my identifier here, which I got because I keep on my competencies up to date, because I'm going to train to the gym. And this is something that we will see in other like scenarios of the world. I mean, if you want to keep on playing in the first team on your soccer team, you gotta train, and you gotta go to the trainings, and you gotta go to the. So what should be different why should be different like in medical training? It's not something that we're gonna train every time that it is possible for the simulation team to establish a lumbar puncture day that we're gonna like have a simulation. What if I can keep on doing it? So I think that, as you mentioned, intentional practice is something which is important. And how do we use this tool in order to maintain competencies? It's something which will be amazing.
Oh, this rabbit hole's fantastic, Eduardo. I drank the Kool-Aid. Sign me up. So the other thing I'm kind of thinking is like, you know, I was really fascinated to, you know, over the years, like Tracy Walbrink from Boston Children's Hospital and Open Pediatrics, she's published a lot about gamification. And then also we heard Sim Wars yesterday, you know, Vinay and VJ and sorry I didn't get names, but our Italian contingent, you know, they really presented about Sim Wars, which I had no idea about this gamification, or they call it Sim Wars, obviously, but you know, and you know, people have got feelings about it, but like they've seen the videos, like, you know, they've made the Sim Wars concept really fun. They've gamified it. It's like this safe space to join up as a team to learn and become better. It's almost like a sim gym Olympics sort of thing, team sport. It's a thing. And I think the other thing is that with pediatric simulation, we have to stay current and competent and actually excellent a lot of the time in high stakes, low frequency events, So, running a defibrillator. I mean, I've worked in children's ED a long time. It's only since I've worked in simulation that I've become, I think, really skilled in running a defibrillator. But I was a pediatric ED nurse full time for a very long time before I entered into simulation. Across a lot of different areas, I have people they're like, everyone sort of rolls that piece of equipment in and they hope someone else takes it over. Like, it's not, there's things like that. There's also, our hospital ran a study called the Suspense Study alongside Australia, Sydney Children's, where they looked at retention of knowledge around taping chest tubes, setting up chest tube drains, taping ETT tubes, IO placement. Like, I was just in a talk just before about how in our under 3-year-old population, like, we've got a real problem around people knowing which size needle to select for an IO for an under 3-year-old. And this is something we don't put in every day. Like, we might put one in every 10 years. We might put one in once a year, 6 months. I don't know. But, it's like we still have to be able to pull that information and that haptics feeling out of the back of our brain in a really highly critically stressful situation while managing a team actually as well. And so, there's these things that you might have an experience clinically where you go, I want to go back and practice that. Or I'm recognizing, because I saw someone else do that and I'm thinking, I can't do, I've become rusty on that. Or competency things. And I think this is great because it appeals to people's motivation, right? And there's the whole like competency thing where it's like, I mean, that's just, unfortunately, it's part of us as healthcare professionals. Like, I might not want to have to prove I'm competent in X, Y, and Z, but I have to for my nursing portfolio. So I'm just going to have to choose when I'm motivated to attend the sim gym.
Yeah, of course. And thank you for mentioning, because even if you want to build that portfolio or you need it to your portfolio, you still struggle with accessibility. I need to build it, but I don't have the opportunity to use the defibrillator. I haven't used the defibrillator in 2 years. So when I'm gonna practice? Accessibility also, because I would love to like retrain my abilities, but I mean the next simulation it's scheduled until July. So till July I will not be able to develop this accessibility repetition, because maybe that will happen in July. But then next one will be next July, or if you're lucky, like during the fall, because there's other competencies to build in between. You're not just a defibrillator person. You are a comprehensive nurse, a comprehensive clinician. So it's like, I'm not going to go to the gym just to work on my arms. I have to work in the rest of the body. So giving that opportunity of having accessibility, repetition, and intentional practice, I think that it is an essential tool for what we are trying to build here. And I think to complete like this, like a structure, I think that it is worth it to like mention that like the digital part of it. Because there's a full like a digital structure in behind that allows to do what we do.
So tell us. So what's the deal there?
We are working, this is working like a collaboration in between McGill University, Universidad Católica de Chile in Santiago de Chile, and the software company that had granted us this as a pilot. Like, I will give you a little bit of background about like the gym model, which was like developed, because this is not something that we're like coming from scratch. Dr. Julian Varas, who is a simulation professional and a surgeon in Chile, he developed this approach as a way to improve accessibility to surgeons to practice surgery. And it is to put laparoscopic boxes and being able to practice, and then to have like this asynchronous feedback from the videos that they are, while they are doing anastomosis, what they are doing, like resections, etc. And then he like developed this like out of the struggles that he as a surgeon, surgery resident, like struggled himself. And then it comes the idea of having like this like safe tool where you can like storage your, or your information and then having like the opportunity to send it and develop that objective feedback. So the digital like environment that we use is it's a platform called C1 that allows us to put the information, the videos, in a safe place where just like the evaluators will have the accessibility to it, and it allows us to guide the procedures to the right person, as we were saying, because we were saying that we are doing technical skills, but in our menu right now, or like in our offer of services, there is, for example, lumbar function, intraosseous lines. We have chest tubes, both like regular and pigtail. We are doing intubations. We are doing like umbilical lines. So that will not go to the same physician, because if I send an umbilical line to a gastroenterologist, maybe that will be confusing. But we are trying to send those to the expert. So that will be a neonatologist, the one who's going to give you the feedback around that.
And are you only using your organization for assessors at the moment? Like, how are you? Have you got like a library, or is it just local? Are you building? Like, what's like like with people reviewing your videos? Is it only within your organization, or are you using international?
No, it is only in our organization right now.
Yeah.
Actually, there's a few like departments that have been actively involved. We have the general pediatrics department that have like 2 group physicians in it. The other collaborators are mostly for clinical, like acute care units, as mostly like everything in simulation. Have a lot of participation from the ER, or like simulation director is actually like the head of the ER now. So we have an amazing accessibility to evaluators in the ER who are experts in most of those interventions that we were discussing. We have also collaborators in the NICU. So that gave us also like another like really good group. And now we are fortunate because we're getting to the point that our like subscribed like evaluators, or gym trainers, as we call them, they're getting like, they're having like a lot of things to review. So we are now including more people, and we have a collaborator, one of our co-authors, Dr. Yayin Huang, who is like the person behind like the all logistics of the evaluation process. She is now doing the process of targeting the right people in order to be those evaluators. And we are looking for people, of course, with clinical expertise, but we want also educators, and if it's possible, simulationists. Okay?
Oh God!
Because we want like a really like comprehensive.
You're gonna go here with a book from here, Eduardo. Like seriously, this is like where the people are to help you. Like this is fantastic. I think this is just amazing. You know, and I also wanted to touch on like my colleague Catherine Lynch, who she was our fellow in Starship last year and finished up early this year. Now she's a new consultant in Cremon Hospital in Dublin, Ireland. She presented a project that she did now in her fellowship with us about she partnered ED and ENT to design a skills-based workshop for doing difficult airway management for senior doctors, right? Because they had, you know, they can be back to the wall dealing with these really difficult airways, you know, and waiting for ENT, or, you know, having to just manage it in the moment for whatever reason. Very rarely, you know, might be once in a career type situation, or many times. Again, skill competency based staff, but, you know, they're really senior. And then it was like, how do you, Kat went through like a whole process of maintaining a senior clinician's psychological safety. And that's really like layered, right? And then also, but the one of the biggest benefits out of that course, I mean, I wasn't invited because, you know, it was for the seniors, and they were all like, it was the first time and they're all figuring it out, right? But they had ENT with them. So they had the specialist people there to train and give feedback. And that collaboration and that connection was huge. And so I'm even thinking like in terms of psychological safety, like say I don't want my colleague within my organization to assess me, but I want someone like, you know, I want someone from like yourself from Canada, or, you know, anywhere, for whatever reason.
Yeah.
You know, maybe I don't feel safe to be assessed by my colleague, or maybe I just want some other perspective.
Yeah, and
it's limitless.
that's, I mean, I think something that we would love to like implement, like going like outside of our institution, and like going back with to the team in Chile led by Julian Varas. They have actually like do something similar, like not only like outside of the hospital, but like international collaboration, because he had used like from this like surgical approach that he got for the surgeons, like how can we like do this program to like actually have an impact in, for example, you were saying like developing countries on like different like resources.
So
we can keep on competencies like with different teams around the world and share like our learning and our experience, because maybe there's like in a high income country like the experience to do how a procedure, but there was not enough exposure, so can collaborate. So they were working with this like gymnasiums and laboratories with laparoscopy boxes, with different teams in Africa, Latin America, and they were like having like this asynchronous assessment by surgeons in both sides in order to have like feedback from other perspectives, other like clinical, cultural backgrounds, and also having that positive impact in different communities. And of course, now we are like really early, like in our process. We are in the process of looking for funding, prove a concept that
and
we want
got
to.
people here that can help you with
That would be amazing. But then, like, am I also like passionate about like global health and like practice equity? So of course, once the concept it is proved and we can like actually show data of the impact of what we're doing, I think that one of our like next steps it's
going to be
to expand as I had like biggest impact or different kind of impact from that perspective too. So we're evolving. We're like really in diapers right now. Or like core is small. It's like the around 40 like pediatric residents from R1 to R4 that we have at McGill University right now. But of course, the intention is going to other programs, analyze their needs, create those specific gym instruments, which will be different kinds of mannequins, different kinds of instruments in order to develop those specific competencies, and then being able to go to different departments. For example, the needs from a RT or a training nurse will not be the same as a training physician or as a training technician in any other like a clinical field. So how can we adapt that also to that? There's different approaches because the administrative and logistic like challenges about like management of time, which hours should be paid, etc. Still struggles there, but we are trying to like having a new approach again, create the right, as you were like perfectly mentioning, right motivation, the right opportunities, and the right way that we can fulfill that circle where everyone wins, like from learning to like income to like accreditation points. Because even if I want to be like super purist to say that this is just like fully like educational approach, everyone have different needs, as we were saying, and we want to fulfill them in order for the engine to keep on going.
So exciting. Like, you know, as someone who loves innovation and, you know, been through last 5 years, you know, going through an innovative process and learning so much about myself and like, you know, just trying to think about just where to go in the future. It's such a like painful but also amazing experience to innovate. And I think, you know, IPSS is such a space that, you know, people share and understand this pain and the struggle. So I'm so excited for you that you're here and you're sharing all about this, Eduardo. I just like didn't even know what to expect from this episode. It's so cool. I'm so excited already. But you know, like I think circling back to the low middle income country piece, like you know, in terms of our healthcare workforce, you know, this is a huge thing. Like we need to train. I don't even want to try and enter into the data points, but it's like overwhelming the amount of people that we have to train for our healthcare workforce in the future. It seems quite insurmountable. And I feel like, you know, internationally training healthcare professionals, you know, we are an international global community and we know the impact of simulation and how important it is for pediatrics. Like, this is needed for the world. And then also, you know, thinking in terms of like, we're a global society and people moving, you know, you've come from Mexico, you've moved into Canada, you know, New Zealand, we have a high proportion of, you know, Indian and Filipino nurses who are fantastic nurses, and I love working with them. You know, and I've been talking to our PediStar colleagues about, you know, getting those cultural, how can I debrief better for our nurses who are international, and for their different cultural needs in English second language. I've got some really great tips off them, you know. And so thinking about this could overcome so many barriers for our low middle income countries, in terms of, you know, you're a multilingual speaking person, or, you know, I don't want to make assumptions here. But, you know, you can speak at least one other language that you kind of have spoken to. And so, you know, and when you get to a certain part in your career, I think it's like, it doesn't matter how much you're working, how much you're making. You know, you want to give back to people.
Exactly.
And that's a huge part of IPSS. And I think this has got so much opportunity that, you know, you can speak a language in a low middle income country, and improve access to your expertise when they want to train and they can't come to you, you know, whatever reason might not be able to go there. And the cost is like so much less, and the accessibility is so huge. And I just think this is just like, you know, I think Peter on day one was talking about Jerry Maguire moments. I feel like this is your Jerry Maguire moment, which is so exciting for you. But I think this is like something that this IPSS community will, you know, in New Zealand we say afi, or, you know, come around and support you in this journey. And like, I'm really excited to see where this goes for you, and who like comes and jumps on board with you on the journey.
Yeah.
Like, sign me up. I'm keen to come out.
Thank you. Yeah, we're looking to grow and to keep on bringing friends into the gym. Like, this is a club, and we want everyone to get training. We want everyone to get healthy, having more exercise in their lives. Like completing the analogy. This is not a closed club. We are actually advocating for people to come and do exercise with us at the gym. So at this moment, our team is small but mighty. As I was mentioning, Dr. Ilana Bank as head of the simulation team, but also like the ER department, Dr. Elisa Ruano with her amazing educational input, Dr. Yain Huang, as we were mentioning, Joy Albonce, the team in Chile, Jerónimo, Julian Varas, of course, who has been like a coach through the process. We are there to grow. And this is an invitation to what we think is a good idea, what we think have potential to keep on growing. Dr. Najma Ahmed, who has allowed us to put this also into a program, because I also have to recognize the trust, because we presented as something, you know, kind of cool thing, but without the support of the program, like it wouldn't be possible. So to thank her also. And yeah, and I think that the point that you made about like the languages, the approach, multicultural is amazing. I always say that I'm more intelligent in Spanish. So I get that point, like having like the feedback in your own language, and like having like that intercultural like a connection could be like used both ways. What if that feedback can be given like by a super like good trained in simulation or like in feedback nurse back in India or in Philippines, that can like actually feedback to that new nurse in New Zealand in her or his own language.
Right.
So it's like this like multi collaboration where we are already can put something in the pot in order to get better. And we think that the singing could be the door to open to all of like these new opportunities.
Yeah.
So yes, please come join us. We will write a membership for you.
Yeah.
And we're gonna give a discount whenever you bring a friend.
Thanks, Eduardo. And then I also think, just final comments, you know, like thinking, circling back to Peter Weinstock's day one keynote, you know, he was talking about, and, you know, Rana, our president, was also talking about, you know, and I think this is fantastic because, you know, I'm someone who, you know, people are like afraid of AI and things. And, you know, I think in PedSim, we are quite excited by it, but we're still trying to figure out a lot of things with it. But I love with this that it's still got the humanistic approach. It's not you could just to put this into AI. You know what I mean? You could put in your points and you could get your AI feedback. Like we've seen this from some projects. This is technology based, improves accessibility, but it has a humanistic connection with it, and that is what makes it special, I think.
I think that it's an excellent point because also upcoming is that the company that we're working with, C1Do1, they are developing new AI tools. Like how if, like, I mean, you are a busy like handlers. Of course, you are having like this like extra activity, which is like to evaluate those videos that are getting to you. So it will take time. But what if we can do it that evaluation easier to you if those like errors, mistakes, or things that can be improved are already marked by AI? So you can just like focus in that exact second or couple of seconds
like a hybrid
of the 10 minutes like video,
and that would save your time,
as you mentioned. The human part, we think that it's still essential, but having the AI aid in order to have like this like rapid cues, detecting where is like the mistake. I think that it's like something which is oncoming, like from like a C1Do1 perspective. It has been used in different like surgical contexts, or like we'll say even in GI, like detecting polyps. Like, but now like putting like into like this new framework, I think that that improvement of the use of time of the evaluator will be like something that will have like an incredible impact. So we would like to have like this hybrid model because we want like to complete the full human circle, and we think that simulation still is a really sensitive thing that needs the human approach. It's a human science on its own. So we think that AI will help, and we are super excited what the new like proposals are like coming from our like partner. Like I mean, not partner, they are like granting us their service in order to give a push to this project that they are again putting their trust in. But it's something which is super exciting coming in, and I think that will give like an extra tool, and like trying to use them in the programs. For example, as one as you were mentioned, I had the opportunity to work there at CSUK last year and to discuss like a little bit about like what these opportunities could be. And like looking forward for all the opportunities that could be to use this tool around the world.
Like even like I'm like thinking here, it's things like you could almost even tailor your feedback model in terms of like I don't know, like I just don't want to think in terms of like this is really just off cuff soft feedback through to really hard feedback, like I might go to someone who to thinking in terms of debrief skills. Say I did something that was really new to me, or I was quite early in my career and I wasn't used to receiving feedback and I was nervous about receiving feedback. Could I ask this person or someone is learning to give feedback as well, maybe, I want this tier of level of feedback versus a mid tier, or like I'm stuck on this, I'm an expert in this and I want to excel at it, and I've picked the top person in the world to give me feedback on it. Be really hard on me. Be hard on me. I really want the hardest feedback you can give me. I want to be better. So like it's really limitless, isn't it? And I'm sure it'll be an incredibly iterative process as you go through it.
And it could be modified. It is a concept. It is a philosophy. It is an habit that we're trying to build here. So we can like adapt it for like different approaches. And you're saying like be a pair like discussion. It could be like a high like develop like a evaluator versus trainee like discussion. So there's different ways that we can approach it. Again, we are like opening this idea to the world. That's what we are here. We wanted like to be like in international forums with the leaders of opinion in simulation to have their input, but also their participation, and being able to find different ways that we can use this idea in order to work for everyone. So
I think this is fantastic, and in my time where I was working with healthy simulation, gosh, I cannot for the life of me remember the name of the movie, but I was I think if you search up on healthy sim and my name in a movie, it will come up for sure. The SEO is really good on that. website in terms of, if you're looking within there. And I got to review this movie, which was about a doctor who was incredibly frustrated by the fact that in healthcare, we need to be partnering with technology companies to be able to drive forward in places like this to advance ourselves and patient safety. And like, it was a really eye-opening moment for me. Sort of seeing that behind the doors, that we have often so many barriers in organizations. Innovation is really hard, and often we face a lot of barriers. And there's a lot of us that have amazing ideas, but it's like, it's really tough. Like, the technology people are like, we need the health people, and the health people need the technology people, but there's risk. But like, how do we, in this world of AI, keep up? And there was just like, it was this big challenge of like, people are dying and you're not keeping up. And like, how the call of basically, to healthcare to, to get involved and to take some risks and things. But it is really difficult on many, many levels. So thanks. This was a fantastic conversation, Eduardo. When I interviewed Christina, the president of CSAM, she said to me, Erin, I really wasn't expecting this. And like, for me, I literally, Samreen Vora, our podcasting committee what do you want to call it, another member, she just said, Erin, I was sort of like, who was it? She said, someone needs to go and interview Eduardo. And I was like, wow, I haven't interviewed anyone for a while. And Elaine and Samreen have really been at the helm of the podcast, probably the better half of the last 6 months. They have been really, and so I was like, I need to go and do some podcasting stuff, and I'm looking to do a lot of work in this space coming up to get this going for IPSS more, because we just have so many opportunities coming all the time for this podcast, and we all want to give back, and get stuck in here. So I think this is a big call. But this is probably like my favorite podcast I've recorded ever. So
no, thanks.
So exciting. Thank you, Eduardo. And we are going to sign off now. Wow, 1 hour and 6 minutes, like
new record for the show.
Yeah, totally. And that's the thing I love about simulation. I think most of us love is you come to these spaces, you have these conversations with people, and you're like, time is like on fast forward because you're in your happy place with your passions and talking with cool people from all over the place. Thank you.
Oh, thank you very much for having us. On behalf of our whole team, it was such a pleasure to having this conversation with you, Erin. Thank you very much.
Thank you.
Thank you for listening to this episode of the IPSS podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.